I often get the question, how did all this happen? Essentially, I would trace this back to a series of discussions that we had with senior management, and especially with our board, that culminated in the board identifying 4 big issues that we believe that our region, particularly Montgomery County, faced and that we faced. And in attempting to create our solution for that, one of the pieces of that was Holy Cross Germantown Hospital. But I think it might be helpful if I just tell you what those are and then talked about the various things that we've done related to this project and others that I think represent Holy Cross using its mission and looking at an environment and trying to craft a solution that works for everybody. So when we go back to 2008, there were four items that were identified, 4 issues, 4 questions, however you want to put it, by our board. And the first one was, there was an access issue in Montgomery County. The biggest single access issue back then was financial and insurance-based. We had lots of people who couldn't get health care insurance, couldn't afford it, couldn't otherwise get it, and they had significant health care needs. And we believe that putting more means of access out there was one of the ways that Holy Cross could help that. At that time, we had 1 health center. It was in Silver Spring. It was on the campus of Montgomery College's Tacoma Park facility, and it was a partnership that we did with them and with their nursing school in particular. And that program had been very effective, but we were of a mind that there were more gaps than that, and there were more areas of the county that had needs than that. And so in response to that first item of identification, we went back and looked at those parts of the county that had the highest amount of uninsured folks and an obvious health care needs. And over the course of the years since then, we've added 2 health centers, one of them in Gaithersburg and one of them in Aspen Hill. And parenthetically, we're going to add a 4th health center in Germantown by the end of this fiscal year. So first issue, people didn't have access to health care for financial reasons and other reasons. You know, transportation, that's why we try to put all the health centers on bus lines and make them easy to get to. We try to put them close to areas of poverty and need. And I think that's been amazingly successful. We, this past year, did well over 30,000 visits at those 3 health centers, which has made a real difference in people's lives. The other thing that we have done was identify that although we had a very large maternity partnership program to take care of people who were pregnant and didn't have insurance, that many more of them were coming from the Up County. And so I'm pleased to say that when Holy Cross Germantown Hospital opens, it will have another maternity partnership location in addition to the one we have in Silver Spring. That will cut down travel and we think improve compliance and access for people who have that need. Since we started that program in 1999, over 20,000 women have been through that program, which is amazing. We have kids in high school now who got their prenatal, whose mom got their prenatal care with us. You know, it's something that we really do view as an important legacy. The second issue of access had to do with hospital access. And when we looked at our region at the time and the county at the time, what we saw was a population that was continuing to grow, but particularly was going to age in ways that had never happened really in human history. And by that I mean that Montgomery County took 300 years to get to 125,000 people, and it's going to take 20 years to get to the next 125,000 people. And those are people who use health care and use hospitals in particular. The most significant place of growth, and particularly growth among seniors, is in the Up County. And so when we began to look at where we might place additional acute care facilities, we did look toward the Up County, and we picked the Germantown area because the Germantown-Gaithersburg area was the largest area in the state by far that didn't have a hospital that had that number of people. Germantown, I believe this is true, Germantown would be the second biggest city in the state if it were incorporated as a city. So there's a lot of people. There was no hospital. There hadn't been a hospital built in Montgomery County in 35 years, and the population had grown by over 300,000 people during that time. So we figured one of the things we need to do is ambulatory access, particularly for those in need, but another one is enough acute care capacity, and we couldn't do it here at Holy Cross because we couldn't build more capacity while also providing private rooms for people, which we believed was critical for our future. So that was the second big issue that we took on, and that has what has led us on this journey. We were pleased to be approved for that hospital, and now we have it built, and we're less than a month away from opening it. So this is really an exciting time for us, for sure. The third issue had to do with, okay, we now have clinics and we now have more hospital capacity, and that's all good. Who's going to work there? We are going to have, over the next 20 years, the largest number of retirements from the healthcare profession that we have ever experienced. We have got to replenish our ranks. And whether that's an issue today or next week or even next year is less critical than it is a 20-year proposition. And so when we picked a site for the hospital, we had the opportunity to place that site on the campus of Montgomery College. And we did that advisedly, and we made it part of a partnership with Montgomery College. That is the first time that's been done in the United States. A hospital on a community college campus with an educational partnership. And one of the big reasons for that was this is an opportunity for us to start to educate the next generation of healthcare workers. The college sees that as an important part of their mission. What did they need? They needed help in terms of both financial assistance and particularly in terms of the kind of in-kind things like providing folks who can do training, clinical sites where folks can get trained. So we have dramatically expanded both of those things over the past 4 years with the college, even before opening in Germantown. But obviously that gives us another opportunity. And we're working very closely with the college today about the next generation of healthcare programming. Because some of it's nursing for sure, but we're also looking at everything from coders to technicians, even to people to work in back office jobs. And we see the college as a great source of that. And I think it is also a wonderful human development story in our county. First generation folks to go to college, that's really important. And I think the ability of us to generate a workforce with good paying jobs is something that everybody's talking about. And you know, Holy Cross makes another contribution there. We made a decision back in 2008 that we wanted to raise the pay of our least well-paid staff. And since that time, we have done that most years at rates higher than what we gave as our average pay raise. And we are now at $13.50 for a starting wage at Holy Cross, plus a very significant benefit package. So we're proud of that too. And then I get to the last piece, which is all of this costs money. And that's not just at Holy Cross, and it's not just at Montgomery County, and it's not just in Maryland, it's all over the United States. Healthcare costs have grown dramatically over 50 years. And we have got to get them on a trajectory that's more manageable. Otherwise, caring for all these seniors is either going to lead us to come up short in terms of the healthcare we provide, or it's going to mean we come up short in having enough money to build roads and to educate teenagers and actually preschool kids. And so we've got to be able to balance healthcare and everything else. And so we've been working very hard during that time to do that. Holy Cross has made big investments in information technology, in relationships with our physicians and with insurers, so that we can do a better and more efficient job so there'll be enough health care there. And I'm very proud to say that when Holy Cross Germantown opens, the prices there, even though it's a brand new facility, will be below the Montgomery County average, below the state average by a great deal. And I think that's a tribute to the efficiency and the hard work of the people at Holy Cross. And I think it's a thing we have to all keep in mind. We want to give great care, but if we want it to be here in the future, we have to invest in things like Holy Cross Germantown Hospital and our outpatient clinics, but we also have to invest in making it more sustainable. The whole industry does, and I'm pleased to say we've taken a lead. You know, one of the things that is important when you take on an endeavor like this, obviously, is planning for it. But there are several other important pieces. You have to have the resources to do it. We've been able to tap into our parent organization. That's been very helpful. But I would say most importantly is the fact that the people who work here have made Holy Cross successful enough that it could take on an effort like this. It is their hard work, really, that is critical here. And I will tell you, there would not be a Holy Cross Germantown Hospital if there weren't a Holy Cross Hospital. And that is true even into this last year as we've gotten ready to open. We've used the assistance and the expertise of the people who are doing their day job, if you will, to help us, and they've done an amazing job. We have also been blessed by support, financial and otherwise, from volunteers who've helped us over 50 years, by our board of trustees, and by people in the community who have made commitments of their time and particularly commitments of their resources. This is a huge undertaking, and every dollar we can raise as part of the capital costs that we don't have to repay with interest frees up dollars to either keep our prices low, which we're very proud of, but also to make investments in things like health centers that take care of people in need and frankly have no chance of ever covering their costs. So to make it all balance out, philanthropy is a very important piece of that. You know, if you do the math, every dollar you raise probably reduces your need to pay back 3 over the course of the life of the asset, and those are dollars that can be spent on new investments, on the care of people who have no other means to pay you, and for trying new things that may not be reimbursed but we think have some real value. I also think in this new world of healthcare where we are trying to invest in care outside the hospital, I think that's critically important, but again, it's not something that is easily reimbursed. So dollars that we can put out in the community, whether it's our fitness program for seniors, whether it's our diabetes education program, dollars for those things are mostly either coming out of earnings of the hospital or gifts from people who support us, and they're both critical.